University Hospital is now offering COVID-19 testing for people of all ages with or without symptoms. Here's what will happen when you schedule your appointment. When you arrive for your appointment, check in with our staff. Make sure that you have a photo ID and health insurance information with you. When you're all checked in, there may be a short wait. Have a seat in our waiting area. Be sure to practice physical distancing as you wait for your name to be called. A staff member will be with you shortly.
Scheduled for your COVID testing for today, okay? Thank you. You're welcome.
Next, a staff member will lead you to the room where you will receive your COVID testing. They'll also explain the entire process to you.
So I'll be taking you to room 5 for your COVID-19 testing. Thank you. And I'm going to explain a couple of procedures that we go in when you go into the room. So you'll have a seat here in this chair, or you can have a seat also there, wherever you like your options. But if you do sit in the chair, you're going to be closer to the phone, which is where we're going to call you. We're going to give you a call. We're going to ask you the COVID-19 questions. You answer yes, no, whatever your answer is. I will close the door. The doctor will be in with you after all those questions are done. Okay?
Yes, thank you. I think I'm more comfortable in the chair.
Okay, you can have a seat in the chair. Okay. Okay. So
Then you'll have a seat wherever you feel more comfortable, on the bed or in the chair. Feel free to use our tablet full of learning resources as you wait for the phone call from the medical provider.
So we have the coronavirus update if that's something you're interested in.
Great.
Okay?
Yes, thank you so much.
You're very welcome.
Answer the office phone when it rings. On the other end of the call, there will be a doctor or a nurse, and they'll first ask you to confirm your date of birth and your name. After that, they'll ask you some questions about your symptoms. They'll ask you if you have ever been exposed to someone with COVID-19, if you have a fever, a headache, body aches, or nausea. Answer the questions as best as you can, and they'll give you your next steps after that. After the phone call, a doctor or nurse will come into your room, explain the next steps, and give you your COVID-19 test.
Hi, how are you?
Doing well, thank you. How are
you? Great, I'm fine, thank you. How was your day?
Doing good.
Everything is good?
Yes.
Okay, my name is Gerald Dawson. I'm one of the nurses here. Also, I'm a clinical care coordinator. I understand that you're here to be tested for coronavirus?
Yes.
Okay, let me explain the test to you a little bit. I'm just gonna...
To test for COVID-19, a trained medical provider will insert a swab or Q-tip into the nose. They will twist the swab to make sure they collect a sample correctly. When they are finished, they will remove the swab and place it in a sealed container to be tested in a lab. They will confirm your name and date of birth one more time and ask you which side of your nose, your left or your right, that you prefer the test to be done. Then they will prepare the test and ask you to remove your mask.
Do you need a little time or are you okay?
I'm ready.
You ready? Okay. As a reminder, we're gonna go right.
Right.
Okay. All right. You may be teary. Okay. All right.
Then they will ask you to tilt your head back slightly and begin to swab the nostril that you chose.
Okay, you good? Okay. You alright?
Yes.
Okay, great. So, everything is done. Because you never had any symptoms and you were never exposed and you never had...
When the nurse or the doctor is finished with your test, they'll remind you that CDC guidelines are still in effect and should be followed. Remember to wear a mask when you go outside, to practice physical distancing of about 6 feet between you and others, and to thoroughly clean frequently touched surfaces in your home.
Sure. All right. Mm-hmm. Okay, do you have any more questions?
How do I find out about my results?
Great, this is a great question. We will call you within 24 to 48 hours, and also you can see if you sign on my chart, you can see your result in my chart. Then we will give you a call to the COVID hotline.
Okay.
Okay?
Yes.
All right, and then we will give you a little card that has a number on it. You can call us as well.
Okay, great.
All right?
Yes.
Okay. Thank you.
Thank you. COVID-19 testing at University Hospital is a quick and easy appointment. Remember to sign up for MyChart today. There, you'll be able to request appointments and see the results of any testing you may have. Remember, the best way to stay healthy is to take care of yourself. Thank you for choosing University Hospital. UH Cares.